We're now approximately 1 year from a decompression of the common peroneal nerve at the fibular head for a patient who had a foot drop. And this foot drop, here's his knee right here, and the fibular head is right at this level, and the common peroneal nerve comes right around this area here. And the common peroneal nerve is responsible for the ability to lift the foot up, as well as to bring the foot outward and upward, and to elevate, extend the toes. He was not able to do that, and it's not clear what happened, but after approximately 1.5 years of continual weakness, he had no back pain and no symptoms from his spine, which is a common cause. He'd never had an operation that suddenly caused this to occur, but sure enough, over 1.5 years, he lost the function of the ability to raise his foot up. And so in the operating room, we were able to release this common peroneal nerve at the fibular head. And what was fairly exciting in his case was that within about 5 minutes after releasing that nerve, we were able to stimulate that foot with electricity and have it move up in the operating room. And we're now 1 year out, and show us how you move that foot. Up and down, good. And the toes, raise it up, great. And so how does that compare to the day before you met us?
I had pain and I could not lift my foot.
Okay, and you had mentioned that. You had pain and some tingling that had come down your leg into the top of your foot, if I recall. Is that correct? And how has that responded as well?
Most of the pain is gone, and the foot is functioning without a brace at this point.
Great. Now there is still some residual weakness in his foot. It's not quite as strong as the other side, but this foot hadn't been working for about 1.5 years until we decompressed it, based on when he came to see us. So hopefully with a little more directed exercise, with a little more use of some bands and a few more months of strong exercise, we'll get that back. But it's about almost full strength, but not quite. And he does have a residual tingling in the top of his foot. And at this time, we've diagnosed that one of the branches of the common peroneal nerve is actually stuck right about here. And it needs to continue to grow down the top of his foot, but there's a place that it can get stuck. And this is where that occurs, where sometimes that needs to be opened up and released so that nerve can continue to grow downstream. But overall, how has this affected your ability to walk on a regular day-to-day basis and the ability to sleep and be more comfortable?
It's much better, and I'm walking without the brace, and very pleased with it.
Very good. Thank you very much.